Okay. Hi, everyone. Welcome. My name is Catherine Ponsult, and I am the supervisor of the School-Based Health program at Ryan Health. And we are presenting on back-to-school policies and what to expect for the 2021 to 2022 school year. Um, just as a reminder to everyone before we start, these policies are constantly changing with the pandemic and COVID-19. As COVID-19 changes, so do the policies to make sure that everyone is as safe as possible. And as we move forward, these policies and procedures will continue to improve. And as they do, we will aim to keep everyone updated as much as we can with more webinars and more content like this. Okay. So to start, I just want to introduce everyone. As I said, my name is Catherine Ponsult. I am a pediatric nurse practitioner and the supervisor of school-based health. We also have Gabriella Hayes. She is a physician's assistant and the supervisor of NINA School-Based Health. We have Caitlin Hansen, who is a pediatric nurse practitioner. She is school-based at MS54. Gabriella is at PS188. And then we have Fatima Sashwani. She is a nurse practitioner. She's a family nurse practitioner. And she is based at PS180. She's another one of our school-based nurse practitioners. And we are all stationed in our respective school-based health centers inside of public schools across New York City, and we're all the acting providers in those school-based health centers. So just a little introduction to Ryan Health School-Based Health program. So we are located in 7 schools across the city. Our providers and counselors work with city staff in the schools to ensure that kids are safe when they're in school and stay healthy wherever they are, wherever they might be. Each school-based health center is staffed with medical and mental health professionals who are available to students throughout the school day. So our aim is to make sure that students are healthy while they're in the school, but we are also fully a primary care clinic that provides services to students, whether they're in school or outside of school. So I see a question in the chat about students getting physical exams in the school. And yes, students can have physical exams while they're at school if the school does have a school-based health center. So here's a list of the services that we do offer in the school-based health center. So annual physical exams, that's the first one. We give physical exams that are required for sports, for camp, and working papers for our students. We also can provide vaccines for students throughout their throughout the vaccine schedule, whatever vaccine they might need. We give treatment for chronic and acute illnesses. We have a lot of students who have consistent asthma follow-ups. If they do have asthma, we can keep their medications in school. If they were to have an asthma attack while they're in school, we can administer those medications and keep them in school and keep them well. We also give medications and prescriptions. We're able to give over-the-counter medications and also prescribe medications to students and diagnose them with and give them whatever they might need. We can send it to the pharmacy, and we also have a lot of medications in stock that we can give just right on site. We do screenings for vision, hearing, asthma, obesity, and other medical conditions. We have a lot of BMI follow-ups, which is for the obesity in our school-based health centers. We're able to give referrals at times if they are needed to specialty care. We are also able to provide mental health services and those are given both on-site and via telemedicine. So we're able to provide both mental health and medical services. Even if a student is off-site, we can do that via video chat through our Hello service. And those are just a few of our services. So we have a lot more, but just to give an overview of what the school-based health centers offer. Now I'm going to hand it off to Fatima to go over what the policies are going to be for the 2021 to 2022 school year.
Okay, so we'll jump into the 2021-2022 school year and all the health and safety protocols being implemented. So as you guys know, the CDC has stated that safely returning to in-person instruction in the fall is a priority. The first day of school for New York City is Monday, September 13th. And at this time, all students will return to full in-person learning. So the schools have implemented multiple strategies to ensure that students are kept safe in school, and they're also continuing to develop appropriate entry requirements. Currently, students are required to have their temperature checked upon entry and complete a screening form before they enter the building. That also goes for any parent or anybody, including staff entering the building. We complete a screening form and also do a temperature check. Physical distancing, which currently calls for 6 feet at all times inside the school. Random COVID testing will continue in school communities. The DOE announced in May. The agency will continue to monitor CDC guidance and protocols around testing and update accordingly. We'll have more info soon on this. And then universal face coverings where developmentally appropriate. So older than 2 inside buildings, most kids, when appropriate, should be wearing a face mask if they're older too. Okay, so there's also going to be increased access to hand washing and sanitizers throughout the schools. Every classroom will have 2 air purifiers, which are highly efficient particulate air filters that lower the risk of exposure to COVID-19. Physical spaces are configured to ensure appropriate distances that can be maintained. So for example, lunch will be served in classrooms or will require assigned seating. And each building is deep cleaned on a nightly basis with electrostatic sprayers, which dispense disinfectant so that it adheres to surfaces without the need to physically touch them. Each building has also identified an isolation room in the event somebody becomes ill during school.
So the isolation rooms are a space that can be used if a student becomes ill or if the screening that Fatima mentioned, if there's anything that doesn't clear them for school that day, they will be in the isolation room space. And the symptoms that mainly qualify them to be in the isolation room are fever over 100.0 or chills, new onset of cough, new loss of taste or smell, and new shortness of breath. So those symptoms would signal whatever staff member to bring them to the isolation room. And if there's a school-based health center on site, the provider at that center would evaluate the student in the isolation room. And based on the evaluation, talk to parents and determine next steps for testing and what resources might be needed for the student. Next slide. As far as the COVID-19 vaccine, it's not required, but it is strongly recommended based on CDC guidance that all students who are eligible to receive it. So currently all students over 12 are eligible to receive a vaccine, that they would be immunized. All teachers and other school staff will need to be fully vaccinated, or they'll be tested weekly if they're not fully vaccinated for COVID-19. All other vaccines that are required by the New York City DOE are the same. So COVID-19 is not a required vaccine currently by the New York City Department of Education. And children who are vaccinated will not need to quarantine in the event of class closures is another important point. So if a student does have their COVID-19 vaccines, they, according to the guidance, wouldn't have to quarantine if they were exposed at school and would be able to remain in school. Next slide. If you are interested in making an appointment for your child to be vaccinated, this is a phone number you can call to schedule them at Ryan Health. There are also many sites around the city to schedule a vaccine appointment. Some you can even walk in and get a vaccine. For children to be fully vaccinated before school starts, the day to get that first dose was August 9th. So prioritizing that as soon as you're able to get your child their first dose of their vaccine. Currently, the only brand of vaccine that children under 18 are eligible to receive is the Pfizer vaccine. So that is a 2-dose series separated by 3 weeks. And then after the second dose, it takes 2 weeks to be considered protected by that vaccine series. So all in all, 5 weeks before the student would be considered protected by their COVID-19 vaccines. You can also, there's the website that's very helpful, vaccinefinder.nyc.gov, and you can search based on where you live or where your student is or where you work and find a lot of sites that offer the vaccine.
Luckily, these students have had months of practice preparing for this return back to school, but just wanting to go over some healthy habits that we want to reinforce in students before coming back. We want them washing their hands with soap and water for at least 20 seconds, covering their nose or mouth when they're sneezing or coughing if their face is not covered by a mask. And we strongly encourage the flu shot once those are available, either at Ryan Health or with your PCP or in the school health clinic. Getting the COVID-19 vaccine if you're 12 years of age or older, maintaining social distance when appropriate in the classroom, to wear a face covering at all times, as we've discussed earlier, and to stay at home if any child is feeling sick, especially if they have a fever. So definitely want parents to have a thermometer at home to be able to monitor their child's temperature while they are there at the house. Next slide. And we wanted to go over other ways to stay healthy. Obviously, during quarantine, kids are staying inside a lot more. They weren't getting to socialize like they were used to. And we have seen an increase in not necessarily eating the healthiest of foods. So more processed foods and more screen time led to repercussions unforeseen during the pandemic, like increased BMI, mental health issues. And we just want to stress that the school-based health clinics provide a holistic approach to primary care and want to address all the needs in your students, not just the symptoms of COVID-19. So ways to stay healthy when at home include spending time outside, staying active, like dancing and moving around, playing a sport whenever it's accessible to them, riding bikes if they have them, going on walks. We also want to encourage limited screen time and increasing reading time or time socializing with friends or family. Stressing the importance of fresh foods, such as fresh fruits and vegetables, drinking lots of water. We don't want our patients drinking too much soda or juice, and then to spend time with family and friends, reminding them that they are not alone during these times that are definitely unsettling for our younger population.
Okay, so thank you all for presenting that information. So this are just some ways to contact us. So to access this webinar later on, we will be posting this webinar on our school-based health website. So to access that website, we will just go to ryanhealth.org/services/school-based health center. You can also navigate to our page from the main Ryan Health page, and we can share that in the chat shortly, that link. It can also be accessed directly, and we will share that link as well. Other ways to contact us and enroll in an SBHC or school-based health center. You can find all of the information on our website, but consent forms can be found at that link provided there again. And we can also be reached by email at school@ryanhealth.org. So now I just want to go to the next slide. And we are ready for your questions. So I know that a lot of questions have already been asked in the chat. Let me just go back here. Okay, so it looks like Fatima, you answered in the chat about receiving the COVID-19 vaccine and the flu vaccine at the same time. Do you think you could answer that? It looks like Allie asked, how much time should a kid have between getting the flu shot and the COVID vaccine? It says vaccine, but I'm thinking she meant COVID-19 vaccine.
Yeah, so there is no, as of right now, per the CDC, there is no requirement on spreading out certain vaccines from the COVID-19 vaccine, so they can be administered at the same time. It looks like, Allie, you have a concern about your child getting 2 vaccines, which can overwhelm the child. So at the end of the day, it is up to you. So if you personally would like to wait, that's, you know, you can definitely talk to your child's pediatrician about that, and how you can maybe space out the vaccines. But as per the guidelines, if one wanted to have their child receive the COVID vaccine and another vaccine at the same time, it is allowed.
Okay, another question. If a student is placed in an isolation room, will they be COVID tested on site? So I'll go ahead and answer that. We are not currently doing COVID testing in the school-based health center. There is still randomized testing at the schools, but we are not performing it in the school-based health center. Some school-based health centers are providing them, but Ryan Health chose not to. We want to avoid students coming to school with symptoms. So we don't want them coming just to receive a test. And if they are sent to an isolation room, yes, the school does have a right to request a negative COVID test prior to their return. If it is suspected that they have COVID, most likely they will be required to have a negative test or a note from their PCP or primary care provider stating that they do not have COVID and that they're not concerned about a COVID diagnosis at that time.
There was a question from Lillian earlier. She had asked, is it 6 feet apart for students or 3 feet apart for social distancing? That's actually a really good question, because according to the CDC school return to school guidelines, they recommend that schools maintain at least 3 feet of physical distancing. But as of right now, DOE is still going with 6 feet of physical distancing, and that's how the setup is arranged in the schools currently. But again, like everything we talk about, everything is subject to change, and this is just what's the plan right now.
And there was previously, they were discussing it having the 3 feet of social distancing for all students, but then for adults, having 6 feet of social distancing. So now with the rising rates, it's kind of something that they are, it possibly is subject to change, but like Fatima said, it's 3 feet is what's recommended by the CDC.
I don't know if this question was answered, but we asked when will the school-based health clinics be open? Catherine, could you answer what?
Yeah, so we're going to be open at the first day of school, September 13th. We'll be open. We are on campus anytime students are on campus. So we will open September 13th. 3 of our school-based health centers are currently open for the summer programming. And if your child does go to one of the schools with a school-based health center, you can always feel free to, reach out to our email address, school@ryanhealth.org, and we can get you in touch with the provider at your SBHC and get you set up with a televisit or whatever might be needed. Refill prescriptions are always available to you, even when the school-based health centers are closed. But we will definitely be open and running right as soon as the schools reopen.
And our hours are every day that the school is open from 8 a.m. to 3:30.
In the Q&A, there's a question about the increased risk for children in regards to the Delta variant, asking about the approach to risk assessment. And for this reason, we are still asking students to be wearing a mask in class, to wash their face. There will still be random testing at the schools. So just proceeding with caution, and I'm sure that the schools will continue to update their policies as things evolve.
Someone asked about children with asthma. Are they okay to breathe while wearing a mask for many hours? And most face coverings do allow for regular breathing, and their oxygen level should be the same if they're wearing a standardized face covering. I can't imagine that there could be some homemade or very thick materials that a face covering could be made with that might make it hard to breathe. So I would just choose like a surgical mask or a breathable material that still works as a face covering that won't impede their ability to breathe. And then of course, if you have a student with asthma, make sure that they have their inhaler in the health center, or if they're able to carry it on their person, that they have it with them if they do have asthma symptoms, so that we're able to respond to those. So if they do have an SBHC, we will have albuterol to be able to give them, but we prefer if they have it on their person if they're able to, at least for the older kids.
For Lizzie's question, will the school or health center be providing any guidance on masks and masking against with Delta? There's been a fair amount of journalism saying that simple cloth masks aren't effective. From my knowledge, there isn't a specific requirement from the DOE as for the type of mask, but from my personal recommendation, I would recommend not using a cloth mask and using a surgical mask if possible.
I would agree with that.
The schools do have mask available if a child ever leaves their mask at home, which I think is an important note to add, that if something happens and the mask is not available with their person, they have masks in the school offices.
And if your child really prefers a cloth mask, because I have had some children at my school who have an attachment to certain masks that they have, there are some ways to insert a filter inside a cloth mask as well. So that's also an option for you.
I think that also one of the most important things when talking about masking is about the best mask is the mask that the child will actually wear and keep on the whole time. A lot of students will, take off their mask or let it hang off their face, or if the mask doesn't have the proper fit, then it's definitely not protecting them. So really that's another important thing to consider. And then, yeah, it looks like somebody asked about how if the city has mandated vaccines for all teachers, why would some be unvaccinated? So the city has required or has said that all teachers should be vaccinated, but if they choose not to vaccinate, they're going to be tested weekly. So that's what the city has said at this point. And also just a note that many of the schools that we work with, their teacher vaccination rates are very high, like 90%. So most staff is getting the vaccine. And if they aren't, they are still being tested weekly.
Also, part two of one of Lillian's questions that we partially answered was if the school has a right to request a negative COVID test prior to school return for a student who was placed in the isolation room. And the answer to that question is it is nuanced based on the student's symptoms, their exposures. There's a whole algorithm to follow of if the test is required for return or not. Typically, it would be yes. If they're in the isolation room, they probably have either a fever, new onset cough, loss of taste or smell, or new shortness of breath. And any of those symptoms would require a negative COVID test to return. But sometimes students are in the isolation room just because they might have answered a question incorrectly on their screening. And after we rectify it, they don't actually need a negative COVID test to return. So that's kind of the answer to that. And the requirements are from the New York City DOE, not necessarily the particular school on the test requirement.
So for the self-testing question, someone asked, does staff need to self-test weekly if unvaccinated or school tested? So they'll need to submit proof of a negative COVID test. So it does not, the guidance does not specify if that would be a self-test. No.
For the question of will teachers wear masks while teaching, definitely yes. Everybody in the building who is inside the building will be wearing a mask at all times.
For the randomized testing, someone asked, for the randomized testing, will the parents be notified if their child is going to be tested? So before the test is given, everyone will be sent home with a consent form. Every parent has to consent to the test. And if a child is very young and very afraid of the test, they will, work with the child. They don't force the test on to the child. But if the consent form is signed and the child is at an age where they're willing to complete the test, then it's just done in the school.
Ali answered, if a child is removed for illness, how do they keep up with their studies in class? I think that schools are actually really strong at being able to keep students engaged with the curriculum because of what teachers and staff have dealt with in the last year. So I can't speak for all teachers or schools, but the teachers I know would do a great job of communicating what the child needs to complete, how to submit it while they're either in quarantine or just recovering from a non-COVID related illness.
I would also ask, in that case, the child's teacher if they can somehow participate through distance learning or Zoom, or because, like, to Caitlin's point, all these teachers are now equipped with whatever resources they need to do remote learning. So, like Ali Smith said, will they be attending remotely in that case? I would definitely, that is something I would definitely bring up with your school and your child's teacher if your child has to be removed for an illness.
Someone asked if someone said that their child has a learning disability and asked how they can make school easier for them. The DOE has hired a large number of additional social workers and mental health professionals and provided increased training for all teachers on trauma, on teaching traumatized students and dealing with students with trauma to prepare them for these students who have just gone through a pandemic to return to school. So they are making a lot of efforts to prepare the teachers to deal with students with trauma and as well as learning and behavior disabilities. They're really putting an emphasis on literacy and getting children who may have fallen behind up to speed, and really putting an emphasis on making sure that nobody falls behind. So even if the student is sent home for quarantine, I think that there's definitely going to be an emphasis on making sure that no student is left behind in their learning and that everyone gets caught up to speed.
There's a question, will the school be able to give my child their medications as they did in the past? So yes, definitely we can keep any medications on site that need to be kept on site, like asthma inhalers, EpiPens, Benadryl. It would be the same process as it has been in the past, where you have a medication administration form filled out by your child's provider, and if you can't get that done, we can also fill it out at our school-based health clinics as well. And once that's filled out, you can bring us the medication appropriately labeled with their name, and we can keep it on site for administration.
There's also a question about children wearing masks when they're outside or at recess. And according to CDC guidance, if students are outside and able to social distance, they do not need to wear a mask. That protocol will definitely be established by whoever staff member is monitoring recess, or if they're in PE class. And social distancing is definitely activity to activity, depending on what they're doing in PE or how they're choosing to spend their time at recess. But if they're able to go outside during the day, if your school facility has an outside playground or area that children can use, they should be able to have a mask break if they're able to social distance in that area, according to the CDC guidance.
Okay, if that's all of our questions, I think that we can go ahead and end the webinar. Thank you so much for all of these great questions and everyone who joined us. I think that we were able to answer a lot of the questions, and I hope that we were able to provide some reassurance about staying safe during this time at school. I think that it's really great that New York is making this effort to get students back in school and make sure that they're safe. And I think that they are really putting in an effort to do a great job. And if you have any further questions, please let us know. Again, we can be reached at school@ryanhealth.org. We will be posting this webinar again to our website. That's on the Ryan Health website, and we are always available for telehealth appointments, mental health telehealth appointments, and whatever you might need. So please don't hesitate to reach out. Okay, thank you all.